Hello, I'm Dr. Dan Farkas, and I want to talk to you today about the importance of the health of your small intestine and how it can affect all different facets of how your body feels and how it functions. Now, we eat food, we chew food, we swallow it, it goes into our stomach where it's broken down by stomach acids, and then hopefully the food that's properly digested gets secreted healthily into our small intestine. Now, in the wall of the small intestine, please understand the small intestine is a tube about 24 feet long that's smooth muscle. Then what its job is to do is to contract and to squeeze. But really what happens in the wall of the small intestine, that's where things actually pass from the true outside of your body to get directly into your body, into your bloodstream. So naturally, this wall, this barrier, it's very sensitive to any bad guys trying to get in there. Let me show you how it works. Under a microscope, the wall of your small intestine, it looks like this. It looks like fingers, and they're called villi. This is where the food, fats, proteins, carbohydrates, and nutrients are absorbed directly through there and get down into your blood. This is also where bad guys can get into as well. Here are the fingers. Might be kind of hard to see. There are little fingers on each one of these cells. Underneath the cells is the blood supply. So imagine this, that things that are properly broken down can be processed and be transmitted right through these cells to get into the blood. That's when everything is going good and there aren't any problems. But if you have dietary proteins that are not properly broken down due to low hydrochloric acid and pancreatic enzymes, what that means is that your meat's not getting broken down, your protein's not getting broken down properly because you're not getting enough digestive or pancreatic enzymes. If you have some of these dietary proteins that aren't properly broken down, if you have any prior history of antibiotic use, any at all in your life, any active infections or prior infections, or any type of blood sugar issues, and this includes adrenal gland problems from long chronic stress or diabetes or being pre-diabetic. If you have any other antibodies from any other infections prior going on, if you have food allergies or sensitivities, or if you have toxins in your blood, from prescription drugs or all pesticides and all the chemicals, new car smell, paint, everything, all these environmental toxins. If you are going through or you've gone through menopause, if you're exposed to too much chronic or acute stress, or you've been through pregnancy or pregnant, this can happen. Now you can see where the barrier is broken down. All these bad things, the not properly digested food, all the bad chemicals can now sneak through, get into your blood supply, and cause some bad things to happen. The first response from your body is inflammation. Inflammation is your body's immune system showing up to fight off and attack the bad guys. Over time, this can cause autoimmune disease. Now, when we say autoimmune disease, we mean things like psoriasis, things like Hashimoto's, hypothyroiditis, where the body's actually attacking its own structures because unfortunately some of these bad things have gotten into those organs and into those systems, and the body has no choice but to go and attack them. And also, unfortunately, some of these structures, particularly the thyroid, they resemble not properly digested dietary proteins. Over time, this is unfortunate. The body can also have malabsorption and nutrient deficiency. So no matter how healthy you're eating or how many vitamins or minerals or supplements you're taking, your body might not be getting and they could just be passing right through you. So the way to assess exactly what's going on inside your body is to test and see what's coming out of you. And that's why oftentimes we perform comprehensive stool analysis to determine, are you getting enough digestive and pancreatic enzymes? Are you getting enough bile from your liver and from your gallbladder? Are you in a state of inflammation? Do you actually have inflammation? Do you have active infections? Do you have blood sugar issues? We can determine all this from testing. Every person is individual. I can't say for sure what each person needs in advance without talking to them and gathering information. This is an example of one of the testing kits that we send. We're able to send these all over the place. We can send them anywhere so that people, no matter where you are, can find out if this is something that we can help you with. So if you're interested in finding out what's going on inside you, I would say this is a pretty darn good place to start.